Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. An intrauterine device, or IUD, is a small T-shaped device made of flexible plastic. They are coated with hormone or copper to provide protection against pregnancy. And Dr. Jitka Lom from ExpressCare is here to tell us more about this contraception. So,
Hi, Jolene.
Hi. Okay, so IUD, I know about Depo, I know about all those other, but you know what, I've never actually seen an IUD, so what is it?
I know, and a lot of people haven't, and it's a form of birth control that you basically put the little device into the uterus. It can stay there for 5 years if it's one brand called Mirena. That one has a little hormone in it, or Paragard, which is a copper coated piece of plastic that you put into the uterus. And basically both of these devices prevent pregnancy by changing the environment inside the uterus. So they do not abort, okay? What they do is basically the copper one creates a toxic copper environment which kills sperm, and the Mirena, the one that's got hormones in it, changes the woman's environment inside the uterus so that fertilization cannot occur. So the beauty is that you spend 10 minutes having this device placed into your uterus, which is pretty much painless. It stays there for 5 to 10 years and you don't have to worry about a thing.
Okay, so I see that you have...
I brought them with me.
You brought them with you. Now, can you show it to us?
Yes, I can.
And like, because I'm very interested to see.
Yeah, so this is how these devices are inserted. I'll show you the copper one first. This is the one that can stay inside for up to 10 years. And you can see it's a little T-shaped device like that, and it's coated with copper. And what we do is we just bend these two little things down. If I can, I don't have my glasses, so hold on, I've got them here to put them on so I can see what I'm doing. And basically we insert them here into this little tiny tube. So it's ready like that. And then that slides in, just like having a pap smear, you slide this into the vagina and then into the hole of the cervix. And I brought a fake cervix with me here. So this is about the size of the inside of your uterus here, if you're a regular normal sized person. So you just basically slide it inside like this, okay? And then there's a little guide here that you push that opens it, and then you take it out. So now this little copper thing will stay inside you for up to 10 years.
Wow.
Yeah, and there's little strings here that this would be the vagina down here, and we clip the strings so they're nice and short and they won't hurt anybody, and they're soft. And then there's basically you continue having normal periods every month and so on. And then one day you decide you want to have another baby, so then you come to the doctor and the doctor does this and just pulls it out for you, which is a little hard like that. That's
wow. Now I'm amazed by, I mean, this little device.
Yeah.
I'm amazed that this
can prevent
pregnancy.
It is incredible. Worldwide, the IUD, the copper one, is the #1 form of contraception because it is so simple. It can stay there for 10 years or even longer because copper doesn't really change. So you can keep it there for longer if you want. But it's excellent at preventing pregnancy. The newer one, this one is a fancier one called the Mirena. Same thing. Basically, it opens up like that, and instead of being copper, this is plastic that's coated with progesterone hormone. And so that changes the woman's cycle, and she stops having periods by having this in there for up to 5 years.
Wow. Now, how effective is this form of birth control? Because I understand that when a man does ejaculate into a woman, they shoot out their sperm really, really fast.
They do.
So how does that
like
not get dislodged?
Well, the amazing thing is that because this is in here for, again, up to 10 years, even if the sperm went someplace and wanted to get with an egg, it cannot fertilize it because it's killed upon sort of like contact with the copper. So it's very effective. When you say how effective, the minute this is placed inside, from that minute it's effective, including with the Mirena, the same thing. It's instantly effective. So like with birth control pills, for example, you have to wait a month or so till they're effective. But with this one, you put it in, you're done until the moment when you take it out. Now with the Mirena, because it changes your cycle, when you take it out, it takes maybe a month or up to 3 months before your cycle gets back to normal and you're fertile again. But with the copper one, it's instant.
Okay. Now with these, the IUD, now can your partner feel it? Because there's like a little string.
There's a string.
And
There's
I've
a
heard
string.
that sometimes they, oh, I feel something in there.
Well,
like,
oftentimes this is something that men will be especially worried about, because what they're forgetting is that this is inside here. This is the uterus. The cervix is down here, and the penis would bump up against here. It would not ever be able to bump up against that because that's inside. So the little strings, as they're inside the woman, become soft and flexible, and they curl around, and they're actually hard to feel. We ask women to feel inside and check and see if they can feel their own strings once a month to make sure the IUD is still there. Blue moon, it comes out. Usually it doesn't. So to answer the question, no, they can't feel it.
all right. Okay. Well, don't go anywhere, because when we return, we are going to answer our viewers' questions about IUDs.
Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you're just tuning in, we are talking about IUDs and how it works. And joining me to answer some of our viewers' questions is ExpressCare's Dr. Jitka Lom. All right, Doc. Now, our viewers, first viewer is asking, what side effects does the IUD present?
Okay, so the copper one, the main side effect of that one might be a little bit of a heavier period. Again, you have copper inside. It might be a little bit irritating. You might get some spotting. That's about it for that one. For both of them, if you are at risk of infection, meaning your partner's unreliable or you are unreliable, having more than one partner, you might risk infection because those strings are there, and if you catch chlamydia or something, it'll go up there all the way up into the womb and give you a bad infection. So if you're monogamous and you're having safe sex, you are completely fine. With the Mirena, that's the hormone IUD. With that one, there's a little bit more side effects because it's affecting your cycle. So first thing is you'll probably stop having your period altogether. Some women like that. On the other hand, there's the other things that might go along with that, such as bloating, such as a little weight gain for some, and even changes in your skin and hair where they may become more sensitive, drier, and sometimes even rashes.
All right. Now, our next viewer says, I just had Mirena put in, and I have developed inflammation.
Yes.
What is the cause?
So inflammation, sometimes again, because there is something foreign inside your body may react against it and give you a little bit more discharge. Again, spotting is possible. Pain is uncommon. If there's pain, then we have to look for infection, or maybe it wasn't placed properly and it needs to be adjusted. Typically, it should not be painful at all. The procedure itself takes less than 10 minutes. It's just like having a pap smear. Typically, you'll have 1 or 2 cramps. That's it. After you don't feel any pain, and it's a very simple thing to do. And the good news is that because of Obamacare, contraception's 100% covered. So if you have health insurance, it's completely free. So if you think about that, you could get contraception for 10 years, up to 10 years, for free. If you're a self-pay person, it's a bit expensive. It can run $700 or $800 for either one of the IUDs, knowing again that it will last you a very long time. And what we tell people is it's basically equivalent to having your tubes tied without going through a surgery.
Okay. Now our next viewer is asking, does it hurt?
Does it hurt? Okay. Putting it in is like having a pap smear. It's not very painful. Sometimes women will have 1 or 2 cramps, but not anything worse than a period type of cramp. And then afterwards it should not hurt at all.
Okay, what about taking it out?
Taking out doesn't hurt at all. People are always fearful of that moment, but we basically use a little clamp to hold the strings and give it a little tug, and that's that.
All right. Now our next viewer is asking, can I have an IUD even if I have never had children?
You can have it. It's a little bit harder to insert because that cervix hole is very tight because a baby's never come through there. So it might be a little harder to put in. But the main thing with women who haven't had any children, we want to make sure that they're monogamous and that they're not going to get any infections because, of course, that could scar them up. So we counsel them very carefully. They can have an IUD, but they should be especially careful with their partner to not get infection.
All right. Now our next viewer is asking, which IUD is best?
That one is very personal to the woman. If you don't want to gain weight, you have normal periods, and they're not very heavy, and you want to stay protected for 10 years, then you do your Paragard, which is the copper one. If you're maybe wanting to have a child sooner than 10 years and you want to lighten up your cycle, maybe then the Mirena would be best for you. And this is something you can chat over, and it's not always an either or. You can sometimes both are fine, and it's just personal preference.
All right. Now our next viewer is asking, are there any conditions that prevent a person from being able to have IUD?
Sure. If you are somebody who has chronic inflammation, meaning you keep getting infections in your pelvic area, this would be bad for you. Or if you have extremely heavy periods, it wouldn't be good for you. Or if you have an allergy to copper, obviously it would be bad for you. So it's not always a good option, but it's a very convenient one for those who can't remember to take pills or they don't like shots.
All right. Now our last viewer is asking, do you have to sustain from sex, or how long do you have to sustain for sex before you're able to get an IUD?
Oh, you could. You don't have to abstain at all. You could just basically have a normal day, come in, put it in, and be ready to go before or after. It makes no difference. It's just a device that goes in, and then from that moment, the sperm is prevented from fertilizing the egg.
All right, thank you so much, Doc.
You're welcome.
Any final comments?
It's just I wanted to put it out there because not a lot of women know about it. There was maybe 30 years ago, there was a IUD that did cause a lot of infections, and so sometimes women remember about that and they're fearful of it, and these days it's very safe and easy.
All right. So we will be back to wrap up the show when Healthy Living returns.